Most of you who have been to the clinic know that we are huge fans of the Waterpik. So I thought I would go over how to properly use the Waterpik and do a live demonstration. Let's go over some basics. The most important thing to remember is that your teeth are not pasted tightly to your gums. So if this is your tooth and this is your gum, there is a space that exists that's called a pocket, and it is normally between 1 and 3 millimeters deep. That pocket runs 360 degrees around every single tooth, and that's where the bacteria or plaque lives and breeds. If that plaque isn't removed every 24 hours, it produces toxins. Those toxins cause the gums to bleed and swell, and if that goes deeper, it can cause bone loss that supports our teeth. They can get loose and fall out, and that's how people wind up in dentures. To complicate matters, the minerals from our saliva deposits into the soft plaque, turning it hard. That's called dental tartar. Now, once dental tartar forms on our teeth, unfortunately, a toothbrush, floss, or a Waterpik cannot remove tartar. So that's why it's important to come in regularly to have the tartar cleaned off to keep the gums healthy. The toxins can also get into our bloodstream. And there's a large body of evidence that shows that that isn't healthy for the rest of our body or our organ systems. The problem with dental floss is that it can only reach underneath the gum into that pocket, about 3 millimeters. So again, this is our tooth and this is our gum. If the gums swell up, that will increase the depth of the pocket, maybe to 4 or 5 millimeters. And if we get bone loss, the bone at the base of the pocket would disappear, and that would increase the depth of the pocket further. So the Waterpik is really good at blasting out the plaque from those deeper areas. Just so you are aware, I don't have any financial interest in the Waterpik company. I just feel like it's a product that works well. I'm going to show you how to properly use the Waterpik on the model. Now, the Waterpik comes with several different types of tips. You want to use the tip with the smallest end diameter because it will result in a more forceful flow of water into the pocket to blast out the bacteria. The Waterpik does come with a flexible periodontal tip, but it's too hard to control. I would not recommend that you use that one. So I'm going to show you what not to do with the Waterpik. This is the biggest mistake that new users make when using the Waterpik. So you don't want to come in straight 90 degrees and clean in between the teeth. This will remove food debris, but it won't remove the bacteria from the pocket underneath the gum. So what you need to do is come in at a 45-degree angle and trace the gum line. That's where the bacteria will be sitting. And then you pause in between. So it's a trace and pause, trace and pause, trace and pause. So you want to do all of the outside surfaces of the upper teeth and then open wide and trace all the inside surfaces of the upper teeth at that 45-degree angle. Then on the lower teeth, it's the opposite. So not straight 90 degrees. You want to go 45 degrees down and trace and pause, trace and pause, trace and pause. So you'll do all of the outside surfaces and then open wide and do all of the inside surfaces. Now, if the hygienist has instructed you to clean in between the roots of the molar teeth, they may tell you to pause right mid-tooth about there. So do that if you've been having some bone loss in between those roots, and then continue on, pause in between, and then pause mid-tooth like that. Since the lower teeth have 2 roots, you would do the same thing on the inside. So you would pause mid-tooth on the inside of the lower molars. And then for the upper teeth, if you're having bone loss between the roots, it's going to be the outside surface mid-tooth that you would pause and spend a little more time on. So you're pausing in between because these are the problem areas where those pockets will deepen first, and you want to spend a little more time blasting out that bacterial plaque. Let's look at the unit. So you pick the smallest diameter tip that's not flexible, and it just clicks into the handle. To remove the tip, we push up on this button and out it comes. There's an on-off button on the handle, and this controls the flow coming out of the tip. So we're gonna leave it in the off position for now. And then we have the water reservoir. So we'll fill this up with warm tap water. If we use water that's too cold or too hot, it is going to feel 10 times colder or hotter on your teeth. It will not feel good at all. And then once it's full, we just click it in and close the lid. This button here is the power button. So that turns the unit on and off. And this button chooses the mode. So there's 2 modes on this unit, a floss mode and a massage mode. I would never pick the massage mode because it only puts out 50% of the water flow. It's not forceful enough to clean out the sticky bacteria underneath the gums. So we'll just push this button and choose the floss mode. And then we have the rate of water flow on this dial from 1 to 10. I would recommend that new users start at a 6. Anything less than a 6 is not going to be effective at removing sticky plaque from underneath the gums. Now, new users might find that when they start using the water tip, that they get blood coming out with the water into the sink. This is not because it's on too high a level or you're doing something wrong. It's because you're in exactly the right spot. The gums are likely inflamed underneath because of the bacteria. So as you use the Waterpik more frequently to remove the bacteria and the toxins, the bleeding will go away. So new users at a 6, and then work your way up to a 10. Now we're ready to use the Waterpik. You are not going to be able to look in the mirror and use the Waterpik at the same time because it will make a huge mess in your bathroom. So what I recommend is that you practice without the water flow on in the mirror first, and then you'll be hanging your head in the sink and doing it mostly by feel. So let's pretend I'm looking in the mirror. I'm going to take the tip out. I'm going to practice the 45-degree angle and tracing the gum line. So it's like this. You're going to trace and pause, trace and pause. That's the angle for the top. And then on the bottom, trace and pause, trace and pause. So I'm 45 degrees down. So you're going to practice that in the mirror, no water flow, and you're ready to go. So let's put some nice warm water into the tank. Gonna fill it right up. And that just clicks down into place and close the lid. Now, there is room temperature water in this line from the last use. You need to make that flow out because if you get room temperature water on your teeth, it is going to feel super, super cold. So we're going to turn on the unit turn on the water flow and feel with our finger until the water comes out warm. So, unit on, we're in floss mode, and we're going to turn on the water flow on the handle. Okay, that's still cold, and there it's coming out warm. So we're going to turn off the water flow on the handle. And now we're ready to roll. So I'm going to hang my head into the sink. I'm going to get the water tip pick in position. I'm not going to turn on the flow until my lips are around the tip. Then when the water flow starts coming, I'm going to open my mouth and let it drain out into the sink while I'm using the water pick. So here we go. Okay, unit on. Tip in my mouth. I'm gonna wrap my lips around and then turn on the flow. Okay, so I'm going to do all the outside surfaces, and then for the inside surfaces, you have to open a lot wider. So I'm just going to show you that. So it's as easy as that. Once you've done all the outside surfaces and all the inside surfaces, top and bottom, you should have used a full tank of water. If you have any questions about how to use the Waterpik, please send us an email at the office, and we're going to be happy to show you how to use it at your next dental cleaning.